AMCA Medical Assistant Questions, 84 questions with explained answers. Question 1. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A. Tell Mr. Matthews that you cannot release the information. Option B. Check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C. Tell Mr. Matthews the test results. Option D. Check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D. Check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation. Test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 2. Which of the following types of gloves can be decontaminated and reused if they show no signs of deterioration after use? Option A. Disposable. Option B. Utility. Option C. Sterile. Option D. Examination. The correct answer is option B. Utility. Explanation. Utility gloves are heavy-duty reusable gloves that may be cleaned and decontaminated if they remain intact and show no signs of deterioration. Question 3. A monitor that a patient wears for 24 hours is called an. Option A. Halter. Option B. 12-lead. Option C. Holter. Option D. Echocardiogram. The correct answer is option C. Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 4. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A. Pulse. Option B. Systolic. Option C. Mean arterial. Option D. Diastolic. The correct answer is option B. Systolic. Explanation. The first Korokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 5. Most specialists are paid by managed care organizations using which of the following methods? Option A. Fee-for-service. Option B. Coinsurance. Option C. Copayment. Option D. Capitation. The correct answer is option A. Fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 6. Which of the following tests is not a part of complete blood count? Option A. Activated partial thromboplastin time. Option B. Differential. Option C. Hemoglobin. Option D. Hematocrit. The correct answer is option A. Activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 7. Which of the following is an example of proxemics? Option A. Eye contact. Option B. Facial expression. Option C. Personal contact. Option D. Personal hygiene. The correct answer is option B. Facial expression. Explanation. The source keys facial expression, but proxemics concerns the use of personal space and physical distance in communication. This item should be reviewed because the supplied key appears inconsistent with standard terminology. Question 8. The primary function of the nervous system is: Option A. To protect deep organs. Option B. To cleanse the blood of pathogens. Option C. To detect changes in the internal and external environment and respond appropriately. Option D. To provide body support and levers for muscle action. The correct answer is option C. To detect changes in the internal and external environment and respond appropriately. Explanation. The nervous system senses changes inside and outside the body, processes that information, and coordinates an appropriate response. Question 9. Which of the following blood pressure readings would be considered stage 1 hypertension? Option A. 148/96. Option B. 116/72. Option C. 126/84. Option D. 178/104. The correct answer is option A. 148/96. Explanation. The source classifies 148/96 as stage 1 hypertension. Blood pressure categories can vary by guideline and era, so use the classification system required by the course. Question 10. Choose the answer that corresponds with number D. Option A. Ulnar artery. Option B. Radial artery. Option C. Brachial artery. Option D. Cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 11. What is the best location to check the pulse of an adult who is unconscious and not breathing? Option A, at the carotid artery of the neck. Option B, on the chest, directly over the heart. Option C, at the radial artery of the wrist. Option D, at the brachial artery of the arm. The correct answer is option A, at the carotid artery of the neck. Explanation. The carotid artery is a central pulse site that is commonly checked in an unresponsive adult because it can remain palpable when peripheral pulses are weak. Question 12. The patient's chart indicates a urine sample was collected at 1800. This means the sample was collected at option A, 8 inches the morning, option B, 8 inches the evening, option C, 6 inches the morning, option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1800 corresponds to 6 inches the evening because times after noon are converted by subtracting 12 from the hour number. Question 13. Notifiable infection must be reported to option A, the patient's physician, option B, your supervisor, option C, World Health Organization, option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 14. To indicate that something lies nearer the surface, use the term option A, distal, option B, deep, option C, superficial, option D, proximal. The correct answer is option C, superficial. Explanation. Superficial means closer to or at the body surface, while deep describes a structure farther from the surface. Question 15. Before developing a medication schedule, you should evaluate the patient's option A, bathroom habits, option B, medical record, option C, daily routine, option D, side effects. The correct answer is option C, daily routine. Explanation. A medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 16. Which of the following would be filled second? Option A, Tommy Turner, option B, Thomas Turner, option C, Tom A. Turner, option D, Tommy Turner. The correct answer is option C, Tom A. Turner. Explanation. The keyed filing order places Tom A. Turner second when the names are alphabetized according to the filing rules used in the source material. Question 17. A patient weighs 83.92 kilograms. How many pounds does he weigh? Option A, 185 pounds. Option B, 210 pounds. Option C, 200 pounds. Option D, 195 pounds. The correct answer is option A, 185 pounds. Explanation. Using the common conversion of about 2.2 pounds per kilogram, 83.92 kilograms is approximately 185 pounds. Question 18. Which of the following is considered a parasitic infection? Option A, Lyme disease. Option B, rabies. Option C, ringworm. Option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 19. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 20. Which of the following is known as swimmer's ear? Option A, otitis externa. Option B, otitis. Option C, otitis media. Option D, otitis interna. The correct answer is option A, otitis externa. Explanation. Otitis externa is inflammation or infection of the external ear canal and is commonly called swimmer's ear. Question 21. Which is an example of a recommended preventive procedure? Option A, eating the recommended daily allowances. Option B, teeth whitening. Option C, childhood immunizations. Option D, daily exercise. The correct answer is option C, childhood immunizations. Explanation. Childhood immunizations are preventive because they reduce the risk of developing specific infectious diseases before illness occurs. Question 22. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 23. In a standard 12-lead electrocardiogram, the measurement of current that the heart muscle produces between the right arm electrode and left arm electrode is known as the Option A, standard limb lead 3, Option B, augmented lead, Option C, standard limb lead 2, Option D, standard limb lead 1. The correct answer is Option D, standard limb lead 1. Explanation. Standard limb lead 1 records the electrical potential difference between the right arm and left arm electrodes. Question 24. The patient's specimen is lipemic. This is usually an indicator that the patient is Option A, smoking, Option B, not fasting, Option C, normal, Option D, in basal state. The correct answer is Option B, not fasting. Explanation. Lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 25. Cellular respiration is a function of the Option A, cell membrane, Option B, mitochondria, Option C, Golgi apparatus, Option D, nucleus. The correct answer is Option B, mitochondria. Explanation. Mitochondria generate most cellular energy through aerobic cellular respiration, which is why they are often called the energy-producing structures of the cell. Question 26. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately Option A, 5 grams per deciliter, Option B, 5%, Option C, 45%, Option D, 45 grams per deciliter. The correct answer is Option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 27. Choose the answer that corresponds with letter F. Option A, basilic vein, Option B, medicancubital vein, Option C, radial artery, Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 28. Which of the following is an example of a biohazard? Option A, spilling a chemical on a countertop. Option B, splashing of blood when a cap is removed. Option C, touching electrical equipment with wet hands. Option D, the potential for a fire to start. The correct answer is Option B, splashing of blood when a cap is removed. Explanation. Blood is potentially infectious biological material, so a splash of blood is a biohazard exposure rather than a chemical, electrical, or fire hazard. Question 29. Choose the answer that corresponds with number E. Option A, basilic vein, Option B, radial artery, Option C, cephalic vein, Option D, median cubital vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 30. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 31. The correct lead from the center of heart to the positive pole of the leg is Option A, augmented voltage foot lead, Option B, augmented voltage right arm lead, Option C, lead 3, Option D, lead 2. The correct answer is Option A, augmented voltage foot lead. Explanation. The augmented voltage foot lead views electrical activity toward the positive electrode on the left leg from a calculated central reference point. Question 32. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 33. The privacy rule gives patients the right to: Option A, access their medical record. Option B, access their ex-spouse's record. Option C, sue the doctor. Option D, refuse treatment. The correct answer is Option A, access their medical record. Explanation. The privacy rule gives patients important rights over their health information, including the right to inspect or obtain copies of much of their medical record. Question 34. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called: Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is Option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 35. The functional unit of the kidney is the: Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is Option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 36. Protected health information stands for: Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is Option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 37. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is Option A, bleeding time. Explanation. Aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 38. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is Option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 39. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A, include a lot of time physician's administrative activities. Option B, allow frequent breaks. Option C, consider the preferences of the physician. Option D, schedule as many patients as possible throughout the entire day. The correct answer is Option C, consider the preferences of the physician. Explanation. Considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 40. Which chest lead is placed on the right sternum border in the fourth intercostal space? Option A, V3. Option B, V1. Option C, V2. Option D, V4. The correct answer is Option B, V1. Explanation. Chest lead V1 is placed at the fourth intercostal space along the right sternal border. Question 41. Which drug is used as an anticoagulant? Option A, fluoxetine Prozac. Option B, warfarin Coumadin. Option C, digoxin Lanoxin. Option D, triazolam halcyon. The correct answer is Option B, warfarin Coumadin. Explanation. Warfarin is an anticoagulant that reduces formation of vitamin K-dependent clotting factors and is used to reduce the risk of harmful blood clots. Question 42. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken: Option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is Option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 43. Collection devices used in skin punctures are called: Option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is Option A, capillary tubes. Explanation. Capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 44. The layer of the heart that is responsible for contraction and relaxation is known as the: Option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 45. Which of the following is an example of negative kind 6? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kind 6 refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 46. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A. The medical assistant can use capillary tubes for the blood collection. Option B. Draw a red top tube before the light blue tube. Option C. Fill a light blue to the top. Option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 47. A patient has an oral temperature of 100.8 degrees Fahrenheit. The medical term for this is option A, pyrexia, option B, pyuria, option C, hyperpyrexia, option D, purulent. The correct answer is option A, pyrexia. Explanation. Pyrexia means fever, so an oral temperature above the normal range may be described as pyrexia. Question 48. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation. Sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 49. Thixotropic gel, found in the serum separator tube red-gray marbled-topped vacutainer tube. Option A, is more dense than red blood cells and less dense than white blood cells. Option B, is more dense than red blood cells and less dense than serum. Option C, is less dense than red blood cells but more dense than serum. Option D, has the same density as red blood cells. The correct answer is option C, is less dense than red blood cells but more dense than serum. Explanation. During centrifugation, separator gel moves between the denser blood cells and the less dense serum, creating a stable physical barrier between them. Question 50. Somatic tremor is the result of option A, muscle movement, option B, loose sensors, option C, unequal amounts of electrolytes, option D, improper standardization of the instrument. The correct answer is option A, muscle movement. Explanation. Somatic tremor is an electrocardiogram artifact caused by skeletal muscle movement, such as shivering, tension, or patient motion during the recording. Question 51. Aspirin and acetaminophen are examples of option A, analgesics and antipyretics, option B, antitussives and decongestants, option C, antihistamines and antiemetics, option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 52. A structure that is composed of two or more tissue types is called a and an. Option A, system. Option B, organism. Option C, organ. Option D, cell. The correct answer is option C, organ. Explanation. An organ is made of two or more tissue types that work together to perform specific functions. Question 53. Choose the answer that corresponds with letter A. Option A, cephalic vein. Option B, radial artery. Option C, ulnar artery. Option D, brachial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 54. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 55. Insulin syringes are calibrated in option A, milliliters. Option B, units. Option C, cubic centimeters. Option D, minims. The correct answer is option B, units. Explanation. Insulin syringes are marked in insulin units so the ordered dose can be measured according to the insulin concentration. Question 56. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 57. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation. Bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result. Question 58. Which of the following specimens are best utilized to measure clotting factors? Option A, serum. Option B, whole blood. Option C, plasma. Option D, sterile blood. The correct answer is option C, plasma. Explanation. Plasma is used for many clotting factor tests because the specimen retains clotting proteins when blood is collected with the correct anticoagulant. Question 59. The phenylketonuria test is used to diagnose deficiency of phenylalanine hydroxylase, the most common clinically encountered inborn error of metabolism. It is performed on: Option A, blood drawn from a newborn's finger. Option B, a newborn's fecal specimen. Option C, blood drawn from a newborn's buttocks. Option D, blood drawn from a newborn's heel. The correct answer is option D, blood drawn from a newborn's heel. Explanation. Newborn screening for phenylketonuria is commonly performed on capillary blood collected by heel puncture and applied to the designated screening medium. Question 60. Important information a patient should know about immunizations would be that: Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 61. The correct lead from the right arm to the leg is: Option A, augmented voltage right arm lead. Option B, augmented voltage foot lead. Option C, lead 3. Option D, lead 2. The correct answer is option D, lead 2. Explanation. Standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 62. The smallest structural unit of the nervous system is the: Option A, spinal cord. Option B, neurofibrils. Option C, neuron. Option D, supine. The correct answer is option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals. Question 63. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 64. A provider withdraws from the care of a patient without reasonable notice of discharge is considered: Option A, abandonment. Option B, malpractice. Option C, negligence. Option D, slander. The correct answer is option A, abandonment. Explanation. Abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 65. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 66. A is a set amount that the patient may be required to pay the provider before they can receive benefits. Option A, coinsurance. Option B, deductible. Option C, copayment. Option D, fee schedule. The correct answer is option C, copayment. Explanation. A copayment is a fixed amount the patient pays for a covered service, usually at the time the service is received, according to the insurance plan. Question 67. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 68. While taking a patient's medical history for active tuberculosis, what type of personal protective equipment is required? Option A, goggles. Option B, lab coat. Option C, gloves. Option D, mask. The correct answer is option D, mask. Explanation. Active tuberculosis is spread through airborne particles, so respiratory protection is required when entering or interviewing a patient with suspected or confirmed infectious tuberculosis. Question 69. You are to draw the blood of a patient. After reviewing the lab order, you realize that you need to draw a complete blood count with differential on your patient. Knowing that this test is drawn in a lavender top tube, which lab department would this go to for processing? Option A, microbiology. Option B, hematology. Option C, coagulation. Option D, chemistry. The correct answer is option B, hematology. Explanation. A complete blood count with differential evaluates blood cells, so the specimen is processed in hematology rather than chemistry, microbiology, or coagulation. Question 70. Muscles that act on the knee joint exhibit two actions. Option A, adduction and lateral rotation. Option B, medial rotation and extension. Option C, adduction and abduction. Option D, flexion and extension. The correct answer is option D, flexion and extension. Explanation. The knee primarily moves through flexion and extension, which bend and straighten the joint. Question 71. To determine our ventricular pulse, the electrocardiogram technician would: Option A, calculate the ST repolarization segments. Option B, calculate the spacing between the P waves. Option C, calculate the spacing between the ventricular repolarization T waves. Option D, calculate the spacing between the QRS complexes. The correct answer is option D, calculate the spacing between the QRS complexes. Explanation. Ventricular rate is determined from the spacing of the QRS complexes because each QRS complex represents ventricular depolarization and normally corresponds to one ventricular beat. Question 72. Which of the following is a standard speed for an electrocardiogram machine? Option A, 50 mm per second. Option B, 100 mm per second. Option C, 10 mm per second. Option D, 25 mm per second. The correct answer is option D, 25 mm per second. Explanation. A standard electrocardiogram paper speed is 25 mm per second, which provides the usual time scale for measuring intervals and rates. Question 73. Which of the following requires all employees' workplace hazard training? Option A, standard precautions. Option B, bloodborne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, hazard communication standard. Explanation. The hazard communication standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 74. Hypotension is defined as: Option A, no measurable systolic pressure. Option B, systolic pressure above 150 mm of mercury and diastolic pressure above 90 mm of mercury. Option C, systolic pressure of 129 mm of mercury and diastolic pressure of 80 mm of mercury. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. Explanation. The source defines hypotension as a systolic pressure below 90 and a diastolic pressure below 60 mm of mercury. Clinical interpretation also depends on symptoms and the patient's baseline. Question 75. Complete destruction of all forms of microbial life. Option A, sterilization. Option B, germicide. Option C, sanitization. Option D, disinfection. The correct answer is option A, sterilization. Explanation. Sterilization destroys all forms of microbial life, including bacterial spores, which distinguishes it from cleaning and most disinfection processes. Question 76. Which agency regulates the Controlled Substances Act? Option A, Internal Revenue Service. Option B, Drug Enforcement Administration. Option C, Special Weapons and Tactics. Option D, Occupational Safety and Health Administration. The correct answer is option B, Drug Enforcement Administration. Explanation. The Drug Enforcement Administration enforces federal controlled substance laws and regulations, including requirements under the Controlled Substances Act. Question 77. The information of blood cells is defined as option A, hematopoiesis, option B, erythropoietin, option C, mean corpuscular volume, option D, hemoglobinopathy. The correct answer is option A, hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 78. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 79. A phlebotomist enters a room to draw blood on a patient who is hospitalized with an infected wound. The site of the wound and any of its bandages are considered which link in the chain of infection? Option A, portal of exit. Option B, susceptible host. Option C, infectious agent. Option D, mode of transmission. The correct answer is option A, portal of exit. Explanation. An infected wound can release microorganisms into the environment, making the wound and contaminated drainage or dressings a portal of exit in the chain of infection. Question 80. The tube of choice for glucose testing is option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 81. Which of the following is classified as abnormally rapid, deep, or labored breathing? Option A, hypertension. Option B, tachypnea. Option C, hypernia. Option D, hyperpyrexia. The correct answer is option B, tachypnea. Explanation. The source keys tachypnea. Tachypnea specifically means abnormally rapid breathing, while deep or labored breathing may be described with other respiratory terms, so the wording should be reviewed. Question 82. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 83. When a patient fails to show for their appointment, the event must be option A, erased from the schedule. Option B, written on a no-show log. Option C, monetarily charged to the patient. Option D, documented in the patient's chart. The correct answer is option D, documented in the patient's chart. Explanation. Documenting a missed appointment creates a clear record that the patient did not attend and supports follow-up, continuity, and risk management. Question 84. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition.